So children, sometimes this inflammation may also lead to the loss of function, like in case of cancer, wherein the body immune cell starts destroying or damaging the cells. Okay. Or like in case of jaundice, wherein the liver starts swelling up, thereby producing excess amount of bile, so which results in the appearance of symptoms of yellowing of eyes, or maybe even the swelling, which is nothing but called as what, edema, which is nothing but the accumulation of fluid, the fluid outside the blood vessels. Okay children, so now we have discussed what about inflammation. So that is the response to by our body towards an infection. But then once we have developed an infection, what do? We go to doctor, we approach him for what? For the treatment. So what sort of treatment will the doctor take up? He will follow two main steps or two main principles in order to treat. First, when you go to doctor, you tell him the symptoms and doctor looks for the signs. Okay, so the first medicine what the doctor recommends will be to reduce the symptoms. Suppose if you have fever may not always be for typhoid or malaria. It can be a normal viral fever. So first he will give the medication for reducing the symptoms. And along with that, he may suggest you to go for some sort of diagnostic test to confirm whether you are having any severe infection or the normal seasonal infection. Then once the diagnosis is done and the doctor comes to know the real reason behind your sickness, then he will go for the next step or the next principle to kill the cause of the disease. And who is the cause of the disease? The pathogen. And what are those pathogens? Maybe bacteria, virus, protista, and fungi. Am I clear, children? Then the question comes, how the pathogens are killed. Now pathogens are killed by two ways, either by recommending antibiotics or by using antiviral medicines. Okay children, so now let us know a little brief about antibiotics. You all have learned about it in your previous standards. So what is an antibiotic? These are the chemicals which are extracted from one living microorganism to inhibit the growth of other harmful living organisms, or preferably which inhibition of which organisms? The pathogens. And how do they do this? By blocking their biochemical pathways or by interfering with their various biochemical pathways. Now these antibiotics, as I told, majorly target the cell wall formation. Now if you see, what are the targets for these antibiotics? They inhibit the cell wall or the chemicals which will help in the formation of cell wall. They inhibit the protein synthesis, or they may inhibit the various membrane functions, that is the functions of the cell membrane, or the various physiological functions, and even the nucleic acid or the genetic material. Now remember children, antibiotics are found only for or are effective, let us say they are effective only on the organisms which have a cell wall. So that means antibiotics are there only for bacteria and fungi. But these antibiotics will not be effective on the organisms without a cell wall. Am I clear? So that's why we don't find any antibiotics for viral infection. Why? Because they lack a cell wall, and not only they lack a cell wall, but they also don't have many biochemical pathways. Hence, antibiotics are recommended for mostly bacterial and fungal infections. And if you can remember, one good example of antibiotic is what? Yes, penicillin, streptomycin, erythromycin, tetracycline. These are all what, children? Antibiotics. Okay. Then coming to what? Antiviral drugs. As I told, and there are no antibiotics for viruses. The reason is they have very limited biochemical pathways, and moreover they don't have any cell wall. And another most important point, they are going to depend upon the host synthesizing machinery. Okay, that is our ribosomes, our cell organelles to survive. Hence, what happens? We are not having any antibiotics so far devised for viruses, but rather we have antiviral drugs which will block some of their biochemical pathways, or they even block their entry into the body. So, antiviral drugs, antiretroviral drugs, if you remember, this is used in treatment of AIDS. Similarly, you also have oral drugs, or the drugs which can be given through genital means, genital organs. Okay, children, but all to control what? The viral infections. So I hope you are clear with what, children? The principles of treatment. So in the coming session, we will talk about the principle of prevention. Please kindly revise. Have a good day. Thank you.